Hello everyone, good evening and Assalamu alaikum. Hope all of you are doing well and you are very interested about MRCPCH. So today actually, initially we will discuss about the very initial some talk about MRCPCH, okay? That is actually very important and after that, we will start our new class. You know that our new batch, that is ninth crash batch, is started just. So I will discuss about this also, but before that, MRCPCH related something I want to share with you, and some new changes are there. So already some of you maybe already know about this, but here I will discuss more. And if you feel that you have any questions, please write in your chat box. We will answer the questions immediately or after the session. Okay. So feel free to ask anything, no problem. Here, just I want that everyone freely join and discuss if you have anything there. Okay. So you know that MRCPCH is a Royal College exam and it has three parts, okay? Three parts. So among them, it is called two are theory exam and one is clinical exam. So remember, it is three exam, but it has more parts, okay? So it is called theory exam and you see it is the website address. You can go through there, everything, every changes and everything you have to know for the exam is there, okay? How the exam was, what could be the questions, so everything is there. So it's very important to go through the website. So what I said earlier, that MRCPCH exam is mainly we can tell by this way that theory and clinical exam. So you have to complete the theory before clinical exam, okay? You cannot proceed to clinical exam before theory exam. So theory exam is actually three parts, or I can say it's previously it was called like MRCPCH part 1 and part 2, but now from 2018 they just changed the way, okay? So now the previously called part 1 is said by these two way: foundation of practice, that is FOB, and theory and science task exam, okay? And another, which was previously called MRCPCH second part, it's now called applied knowledge in practice. And what they demand from the FOB and TAS and AKP, it is very elaborately written in the website. But yes, I will just tell you the nutshell, okay? So many times I face this question, that is there English language test required in any part or before clinical, any training certificate is required or not? So I have to say that English language test, that means IELTS or OET, is not required for the exam, okay? But it is said that before appearing clinical exam, you should have at least OET 7 or it is called IELTS 7 or OET B plus. It is their website they mention, but they never ask you about your OET assessment or IELTS assessment situation. They never ask you, okay? But yes, it is an English exam. So you should have a minimum English idea, okay? Without it, you cannot proceed anything. So it's not required, but if you, after completion of your MRCPCH, if you want to proceed for GMC license, that time you have to appear OET. So it is not mandatory for the exam, but for the GMC license, that is the UK license, okay, as a practitioner. After that, any training certificate is required? No, no training certificate is required, even not for the clinical exam. but they suggest that you should have at least 6 months training for the FOB-TAS exam. That means part 1 exam. And for the AKP, they suggest at least 1 year training should be there. For the clinical exam, they suggest at least 2 years training should be there. So it is like written should be, but they never ask you where is your training certificate. They never ask you. Only they require your MBBS certificate. Okay, so this is a questions which I randomly faced. Okay, so after that, how is their exam system? Because here all of us are just here discussing for the MRCPCH exam. So exam system is online system and in center basis. So two way, it is online or in center. So but whatever you are going to appear online or test center, you should have a computer. It is a computer based exam or laptop. Okay, so it is not like you are something right and give the answer in the test center. No, it is the computerized way. Okay, online system even is like this, and also the test center. And the new things is, before COVID era, only the test center was there. But when COVID started, they stopped the exam for 1 to 2 diet, and then they started online, and online become very much popular nowadays. Okay, so it's a great rush nowadays, because when you want to book the exam, you will see that within 1 to 2 minutes books become vanished. So now from 2024 September exam, they announced that if you are in a country where test center is available, that time you cannot apply for the online system. They try to reduce the pressure on the online. Maybe, I am not sure. They not. Please take care your mic. Okay. Take care your mic, okay, everyone. Okay, so what I said that that if you are in a country like your country in a Saudi Arabia, your country in a Pakistan or India, that times you could not in future you will not apply for online system until you have some physical inability or you have some problem. You have to show it in your RCPCH. Okay, so some evidence you have to put to booking for the online system. Okay, so this is a new changes which is mentioned in their website. So it was a great benefit, although initially we were very much afraid. I was in COVID era. Okay, so initially was very afraid that how is the online system? It's a very difficult. No, many examinee passed through this system. It's now very trusted. Okay, it's a very trusted way to appear through the online system. So many persons are interested to give online system, although they have test center. There are many countries where test center is available, where test center will not be available. In that country only can give online system. Okay, but here, if you are interested to give your exam, first things you have to do the exam account. Your exam account should be there. So whenever you give the exam, if it is 2030, no problem, but make an exam account in the RCPCH site. So how you make your exam account, it is not today's part, and I can share you some PDF. Please remind me if I forget. Just I can share you some PDF so that you can understand how you make your exam account. But believe me, this is the first task you have to do. So all of you if you are interested to do this exam, you should make a exam account in the RCPCH site tomorrow. Okay, so it is something very important, because if you want to book the exam in that time, if you make your account, you will not see any seat. You have to make your exam account at least 2 weeks before. Okay, 2 weeks before. They say actually 10 days before you have to complete your exam account. So exam account means in the RCPCH, any website, what we do for the first, we will give some our identification, that is name, where we are, from where we completed our MBBS, and after then we you have to put your primary verification, they said it, primary verification certificate, that is the MBBS certificate. Then they verified it, then they will give you a number, which is your RCPCH number. You should have a RCPCH number, and you have to be very much confirmed that you get your number. Without your number, you cannot proceed further. Okay. Then when the exam is opened, okay, so you should have to know it, and it is time to time changing things, but for now you just know that for the Optus exam, the exam date is 21 February. It is only for the February. Okay, they will give you June and October way. There is actually for the FOPTUS exam, it should be February and September. Okay, it is, sorry, May and September. It is January, May, September for the AKP exam, and for the FOPTUS it is February, June, and October. Okay, so you have this chance to give this exam at this time period, but the exam booking will be open just 2 months before. So it is mentioned, you see, December 4 December is their booking open time. Okay, so it is, they said it to be confirmed, so it could be changed. And also they give AKP, so it is just today I captured it, so it is the latest. Okay, so for the 2023 exam date. So you have to have a RCPCH number, and then you can book your exam. And you should know that when you are going to appear online invigilation system, they just change one thing, that before COVID, before 2023 October, I think 2023 October, it was you have to require a passport only. Okay, passport or driving license or your NID. But now they are making changes. Everything is applicable for September, that you should have an original MBBS certificate also during the exam time. It is a new change. Okay, so you should have this. You should have this. It is written here. So it is something change. So you have to have these things. That is during the exam time, when the your exam will be there. In time, you should have passport. You should have, that is at least 6 months validity should be, and also it could be NID, it could be driving license. So you have to have this, along with you should have MBBS certificate. That is a new addition. Okay, and when you are proceed for the payment, it is very important. Like you are book your exam, and within 30 minutes you have to complete your payment. So for the payment, that it is something like credit card. Okay, so credit card is required, but you cannot use debit card, and every country have different rule. You know, as there some something going on, inflation of, for the dollar. So there are different systems in the bank. In the different country, it is rules are different. So you have to talk with your bank at least 1 month before. At least 1 month before, you have to talk with your bank that you are going to transfer amount. So what is the procedure? And even for this procedure, you should have, for the Bangladesh perspective, I know that you should have passport. Okay, so valid passport you require for the any transaction which is more than 300 USD, more than 300 USD. Like in that times you have to, you can do this, and something called national bank or central bank I have to give permission for this. So the amount is day to day, it increasing. So nowadays you see both papers, if you give, it is 755 euro. Okay, so you have to make it in your own currency, then you can understand how much this is. Okay, so it's a costly exam, too much costly, actually I should say. So you see in the AKP it's near about, in Bangladeshi taka it is 1,20,000 and 870 euro. Okay, so euro is more low, but they just increased, I think 6 months ago they increased it. And the exam FOB task, and you can give, I say that you can give like FOB early or FOB task early or AKP early. Anyway, you can go FOB then AKP or task then AKP, but I should go by the same way. Okay, like FOB task and then go for AKP, because AKP is more vast, more elaborative and more complex. Okay, passing rate also AKP is not very much good than the part one. So takes time, and but if you have very much clinically competent, you can go for AKP also initially. Okay, if you understand their rules and regulation, you know about the exam system, you can go for the AKP first as well. So many persons asked me that how much time I have to give for the exam, what is the books needed, everything mentioned in the site. And for the books, just I think these are the books we should read out. But remember, it is different from the previous. Like when we previously we were read, I think 2 to 3 years ago, that times it was different, because some days, some years ago, there was nothing, like only there is some past test was there. But nowadays, past test is only to enhance your knowledge. Like if you want to know more, if you want to read more, that is different issue. Some students, some medical personals love to read. So okay, nice to see this. You can read past test. CPCH published some, they do not recommend past test. Okay, they recommend FOB book or like task book. For the FOB, there is some FOB case book where 50 cases are discussed. That is very important. Okay, 50 cases are discussed. It is called clinical case book for FOB. And same, there is some task also. Pediatric guideline is very important. It's like a book which is important for all the exam. And something like neonatal guideline also, we have to read some topics, not all the things, because neonatal guideline is very vast. Then recall file, it is the most important things. It is the most important things. Without recall, No one can pass. Okay. So recall, you mean, no, recall means I am just after giving the exam, I come out from the room and then I say that my teacher asked me such things and such things and such things, and everyone just take these things, take this information. So this is recall. I just recall something. RCPCH said that we can discuss among us recall, but we cannot make it very much public. Okay, but recall is very important because there are many repetition. But recall is something like when we do some recall, sometimes we cannot recall properly. Sometimes we recall some parts. So recall, you can't read only recall. You have to know the actually topics. After then, you can also read the recall. So when you read everything, then recall will be very helpful. And before exam, you have to read only recall actually. Okay. And there are sample papers also. Sample paper means in the RCPCH, you will get some link for the sample paper. And sample paper link is very important, from where there are many sample papers. That means they give you sample papers so you can read it. You know that every exam system, they give some sample paper so that we can get some idea how the exam is. So sample papers is also very important. And there are different books that can you read, but remember, it is not the Nelson or the very large vast book. Okay, Nelson is not recommended by the RCPCH. And the task is same, but before going to a very deep in task, I should say the task has something special, like statistics is task issue. And also you have to know very much in details with the pharmacology, okay, physiology. Some physiology is important, like pathogenesis of disease. So task means theory and science, okay. So for the disease is there, you know the diagnosis, but why it happened, it is included task. Investigation related questions come in task. Treatment related questions come in task. So if I say that FOP and task difference, then you should say that you see it is FOP and task. So FOP, they will ask you what is the diagnosis. They ask you what is the diagnosis. And in the task exam, they will not ask you the diagnosis, but they will ask you like why it happened. So if you understand the diagnosis, then you can go for why. Okay. So it is actually exam, you cannot totally differentiate FOP and task. Many questions are very similar, both FOP and task. Okay, and then investigation and treatment, you will get everything in FOP and task both. Same question, investigation, treatment. So pathogenesis only for the task, organism name is only for the task, but FOP is to make a diagnosis. And then statistics always for the task, okay, and more question with the pharmacology with the task. So this is the difference. If you want to differentiate your exam way, like if you think that I will give exam, just 1 minute. Yeah, if you think that I will give the exam separately, FOP and task, in that time I should say, first take your preparation, then book only one exam. Sometimes some people have some problem like I cannot give exam whole like 2.5 hours, 2.5 hours. That means total 5 hours exam you have to give for the part one. If you want to give is one way. So sometimes some female have problems, sometimes male, that I have kids, I cannot give 5 hours time. So they can go, and also some persons want to take separately, they can go separate exam system. But remember, if you want to give exam separately, first take your superficial preparation for the both. Then you book one exam, then you take preparation. Okay, it is the good way. Or you can go for exam both in one settings. Okay, so your exam will be morning time FOP and the evening time task. Okay, so part one exam is like this. There are some difference, you understand. So here I am not discussing about AKP exam. So just see that there are some question. It is like single best answer. And there are something best of 5 and extended matching question. From September 2024, they just removed the EMQ. They just removed the EMQ, but up to 2024 September, they keep this exam this way: single best answer, best of 5 answer. So how these things are, so how we can understand? We can understand by checking for casebook, task casebook. So there are 5 options. You have to take the one option. It is the single best answer or best of 5. Okay, and extended matching means you have 10 to 15 option and 3 questions. You have to take answer from the 10 to 15 options. It is called EMQ, okay? Extended matching questions. And single best answer, best of 5. So you can ask me that, is it good for us that they remove EMQ? They just remove the EMQ, no? EMQ is removed from 2024 September. So we cannot comment now, okay, it is good or bad. We cannot comment because they are changing. There are some systems, okay, and day by day they are like many things they can change, okay. So I think if you want to give exam, don't make delay, because you know sometimes systems are not favorable for you, maybe, or not. So take the opportunity if you have time. Okay, so you do not have all the times good health, good surroundings. So when you get time, you just utilize it. So this is the way, and it is not like that you get fixed question. It is not like that. So the question could be different, but it is changed for the 2024 September. They will only give you 100 questions. Okay, they will only give you 100 question and time will be 2 hours. Okay, it is 120 minutes. But now up to the before 2024 September, the question number is not fixed, just they can it is 79 best answer or SBA. EMQ6, it is vary. So when it is vary, how they make the result, okay, how they make the result, something like result is for the like different way. It is the average. They make that this time like questions is very difficult, and if it is happen that everyone not making very good, then the passing marks they can fixed it is 55%, then up to 55% pass. If you get 54 is not passed, and then they can make it even 62, 63%. Then so it depends on the question times and how the examinee perform. Okay, and this is some systems are there. Actually, there is a one system through which they make it, and they explained it elaborately, but it's not required for us. So it is like you have to do this like you have to do the best. Okay, then the result will come. So how much preparation time? It is depends. Okay, we cannot say it is 2 months, 3 months, 6 months, 1 year. It depends on your background. You have to understand that I am now I can now comfortable to give the exam. You can understand day by day. Okay, it's not something that you can 6 months on an average it is said, but it's not like applicable for all. So you have good experience and you have opportunity to study more time, then you can make it even 3 months. And I have a lot of students who make the exam 3 months. Okay, sometimes I also frightened why you are giving exam like it is it's my fame. So if you have anything problem in the result, then I will not comfortable. So they are very much confident. They just give the exam within 3 months. I see many students like this. So it is depends on you, how much time you can give, how much confident on you. Okay. Now, why you are giving MRCPCH exam. So it is vary from person to person. You can enhance your knowledge, or you can want to go UK and train yourself in the NHS. You want to get GMC license, or you can want to go Middle East, work there. Malaysia, Singapore, and Sri Lanka. Their main exam is, or only the exam system is MRCP, MRCS, MRCPCH, MRCOG. Okay, so Malaysia, Singapore, and Sri Lanka, they do not have any other exam way. Okay, if they got MRCPCH, like in the Singapore, I know that they just give you license. Okay, when they complete the MRCPCH, so they give the license to work there. Okay, for their students also the outside, so they have no individual body. Okay, just they are collaborating with the RCPCH. Even in the Australia, after doing NHS service 2 years, anyone can move. Okay, in the Australia, so there are many opportunities. And also you should know that MRCPCH is a very prestigious degree. Really, it is very prestigious degree, and the way of reading is very interesting. Okay, very, very interesting. Okay, just I want to share you that now I am for the last 2 to 3 years, I am just running a course. 2 years, sorry, 2 years. I am just running a course, and I am working as an associate professor of pediatrics. I've completed my MD from the Bangabandhu Sheikh Mujib Medical University, and after I completion of theory exam, I started this. And it was initially it was like helping some friends, and now it's become like it becomes my dream. Okay, so I am very much I am very much pleased to the Allah that Allah give me this opportunity. Okay, so just I want to share that for this from this course, you will get that I just teach my students, or I should say my colleagues. All of you here, all of you are very much knowledgeable, I believe, and also I see that many persons are who are very much good background, and they start to read it. So my colleagues who are here, they can take this, and it is such a way like it's a system wise. Okay, so I just take this all the syllabus into different topics. Okay, so it is like topics wise discussion, like CVS, respiratory system. So now the course is like 6 months, near about. It is we can cover it within 5 months, but after then I put some times to prepare yourself for the upcoming exam and for recall discussion. So here what happened, like CVS exam, we will take weekly 1 class, and we will provide you the PDF notes. For these PDF notes, you have to read out, and you know that which things is very important. In the PDF note, we thoroughly write everything which is needed for the exam. Okay, so one PDF note having everything, on the topic. So it is also included some recall things also. Okay, so you can read these things. After then, you have to read the case book discussion and pediatric guideline, and you will be ready for the exam. It is not like that you have to go through many things. So again, after PDF, you have to read the recall, and recalls is also such a way I will just discuss like topic wise. Okay, so you will get topic wise recall. You have to read out the recall. So one topics, when you read my PDF and then recall, pediatric guideline as well as case book, you will ready for the exam. okay, for these topics only. So we will just cover all the topics, and then we will we have some scope of giving exam weekly one day for all the topics. Okay, so having a scope very it is a scope of reading extensively as well as very conscious way. And if you have minimum time, you do not have enough way to read out everything, every books in that time, you can get the way. Okay, so another thing, it is live, it is not only recorded class, because I think that live class will be more interactive. Okay, so live class also, if you join, then you can understand that live class is also very much interactive way. So if you wants to know the I just want to share with you the topics. Just give me some time. So this is our topics. I think you can see this. Just 1 minute. So this is the topics. So you will start with the GIT, then hepatology, nutrition, respiratory system, cardiovascular, nephrology, infection, hemato-oncology, dermatology. So many topics. Ethics is very important. So at least I can assure you that everything will be covered here. Okay, and then recall also. And another important things that if you one time join, you can remain in the group. If you are like regular in the course, then it is depends on me, like you can remain until you pass. Okay, so one time join, and then like sometimes it happen, some persons join, then they have some problem, they shared with me. Okay, I just extend their timing. Okay, it's a very some things which happen many times, so my students knows very well. So other than these things, what we are doing here, so you see PDF also is thoroughly discuss everything that is required. So you have to be sincere. Okay, after join, then when you join, then you have to be sincere. Just I want that someone joined with me, those who are sincere and wants to read it, wants to know it. Okay, so it's very important. Do you have any questions related to the like MRCPCH or something? You can ask me. Or we will start our GIT class if you don't have any query. Yes, Dr. Nishat say. Dr. Nishat.
Ma'am, yes, ma'am. Assalamu alaikum. Ma'am, when will the mock exams will be taken? Immediately after lecture or after the whole topics will be discussed?
No, after each topics, when we completed each topics, like GIT include hepatology and nutrition. Okay, so after we complete GIT, hepatology and nutrition, it's required 2 class. So after then I will put your questions and you have to answer it, you have to write it and then send it to me individually. Okay, then I will give feedback individually. Do you understand? It's okay.
Okay, ma'am. Thank you.
I will give the recording, Dr. NR, it is mentioned here NR. So I will give the recording for the introductory class. Okay, because something, if you have any problems, like you can also do it. Okay, so in the RCPCH you can go and you can understand the things. Okay, and other than Dr. NR, maybe Dr. Nayab, please ask me privately, okay, or send me, knock me through WhatsApp. Can I join NHS after passing only 3 exams and OET? Yes, you have to apply for job, and their health system is starting like FI1, FI2. That means it's some country, they call it house job, that intern. Okay, after then ST1, ST2, ST3, and it is extended up to ST8. You know that they after FT5, it is after then they can apply for the consultant 5 years. So it is for the medicine, but for pediatrics 8 years experience required in the NHS. Then you can apply for the consultant post. But it is very, that if you have in your own country good experience, and then you can work there after 1 to 2 years. Also you can apply for the consultant post. It's depend on your experience and working schedule. But after completion of MRCPCH, you can apply for ST4 job. ST4, that means above register. I don't say that it is for the after theory exam. I said after completion of MRCPCH exam. Without clinical exam, you can't do anything. You have to complete MRCPCH. Theory, if you just complete theory exam, it is nothing. Okay, it is nothing. But there is another way. Like if you complete FOB, after then you can go for DCH clinical exam, and when you complete the DCH, you cannot apply for the GMC license. But it's one type of degree, DCH. So it is from the FOB, and after then clinical exam, okay, DCH clinical exam. It is different route. It's not applicable for everyone. But even for the clinical exam, for the female, for the theory exam, when you go for online and you are a female, you want to cover yourself, like so in that times you can apply for a female invigilator only. Like for the religious purpose, they give female invigilator only. Okay. So I think we completed it. Now we can go for our class. So just want to give